Hello, I am Dr. John Willey, and I'd like to welcome you to our ENG 5305 Nursing Communication class. This is a small class, which is certainly to our advantage. I want you to understand from this moment, anything that you need in the class, please rely on your cell phone, telephone, any means of communication. Primarily, we'll use email, of course. Or Zoom, but still understand that I am at your disposal. I am going to help you and support you in every way that's possible during this class. I certainly look forward to the class. I have had experience in teaching nurses before. I did for several years in Mobile and at Pensacola. I had night classes preparatory to their going on the 11 to 7 shift. We had classes at Pensacola State with a lot of nurses in them, and they would be there in the evening before they started their night shift back in the day, of course. And then Mobile, I taught a lot of nurses in Mobile. My wife was a nurse for many years. She was a psychiatric nurse, which is quite an interesting endeavor. And then she was also, a floating nurse at Sacred Heart Hospital in Pensacola, and other places. So at any rate, again, we are going to look at several varieties of communication that nurses deal with on a daily basis. And it's something that you likely don't think about until you're in that position. So again, that you have a lot of pressure sometimes from families, from physicians, from nursing supervisors, or those in your care if you are a supervisor. So the complexities, of communication for nurses is probably because so much of it is varied a great deal, almost like in the military. Then you have your, you have your non-commissioned officers, you have your enlisted personnel, and then you have your officer cadre, and even the higher officer cadre. And it's a little bit different in terms of communication, and not just having to snap to attention. You don't have to do that, of course, in the halls or in the ER or anything else. But still, the varieties of communication and the complexities sometimes are something that people don't associate with a nurse program, where they're thinking more about the scientific, dealing with a variety of complex drugs, and then patient outcomes. They're not all the same, as my wife will testify from having worked in a mental health facility. So if you have had that pleasure, then you realize that almost anything can happen, in those places. So at any rate, I don't want to be too long here. Perhaps I have been already, but still, it's a pleasure to have you in the class. Understand, that now I'm not just a professor in this class, but I am the person that you need to seek out about anything that comes up unconditionally. If you think about it, you've made a mistake. If something comes up, you either text me, email me, call me, whatever is necessary. So, when you leave this course, I want you to be able to tell your peers that this was one of the most enjoyable and, one of the most beneficial courses that you've taken in the program, and that you'll, I hope, recommend it to other people. That's happened to me before in different programs. So I look forward to it happening here too. Again, thank you very much. Welcome aboard, and we are ready.